Hello, this is Dr. Wajid Ali, board certified plastic surgeon working at Care Hospital, Gachibowli. Today we will discuss about burns. Burns are a very common condition. There are different causes why burns occur. Burns may be termed as flame burns when due to a fire accident you may catch a fire and the body may be burnt. Second condition is scald burns where there is due to falling of hot liquids or oil the surface of the skin is burnt. Third category of burns is chemical burns, which is due to fall of certain acids or strong alkalis on the body. This can also cause burns. Fourth category of burns that can cause burns are electrical burns. Due to electrical mishaps, there can be burns on the body and that requires special treatment for the burn wounds. So, how are these burn wounds categorized? So, burns are described based on the thickness of the skin tissue that is burned and the surface area of the burns that has involved. Depending upon the thickness of the burns can be superficial thickness or they can be deep thickness. In superficial thickness, only the superficial layers of the skin, typically the epidermis and the superficial dermis are involved. In deep burns, deeper layer of the skin, that is the dermis and the underlying subcutaneous tissue may be burnt. The second way of classifying the burns is depending upon the thickness is first degree, second degree and third degree burns. First degree burns typically involve only the epidermis and second degree burns involve the epidermis and the dermis, and in third degree other than the epidermis and the dermis the deeper portions of the skin and subcutaneous tissue are involved. Depending upon the surface area of the burn that is involved, they can be categorized based on the percentage of burns that is involved. Usually burns which are less than 10% are classified as mild burns, whereas around 30 to 50% are categorized as moderate burns, and anything more than that is classified as severe burns. So what is the treatment of the burn? The first aid of burns. First, whenever you have a burn, remove the part or the patient from the area of the burn. You might have to douse off the fire if the patient is still burning. Second, after once these precautions have been done, the second thing that is done is to cool the part. If it's a small area, you can just run normal room temperature tap water on the part, or maybe a bit of cold water on the part and then cool off the part. Then cover the burnt area, cover it with anything which is clean, and then bring it to the facility where the burn wounds can be managed. At the hospital, your doctor may assess your condition and stabilize you before opting for the treatment of the burn wounds. After the patient is stabilized, there are different ways by which your burn wound can be treated. One common way of treating the burn is by applying dressings. But if they are major degree burns or if they are deeper burns, they may require certain other modalities. Collagen application is one new technology where we apply a thin layer of collagen and which heals off by itself and it gets removed. But not all conditions may require collagen dressings. Third is if there are deeper burns, it may require removal of the dead tissue. This is called as eschorotomy or escherectomy. So once the dead tissue is removed, it may need to be covered. This reconstruction is typically done by utilizing the skin from your body part such as thighs, where we remove a small amount of a very superficial thickness of tissue and then transplant over the part where it is required to be reconstructed. This is called as split thickness skin grafting. So this was a short video about burns and its management. Thank you.